The operating room is a place of hope, a sterile theater where science and skill converge to heal the sick. We trust the person holding the scalpel implicitly. We give them our bodies, our futures, our lives. But for 33 people in Dallas, Texas, that sacred trust was violated in the most brutal way imaginable. They went in for surgery expecting a cure, but what they got was a monster. This is the story of a man who took an oath to do no harm, and then became a master of it. He was a brilliant and charismatic neurosurgeon, a rising star in the Dallas medical community, who would look his patients in the eye and tell them, "I am the best. I can fix you." And they believed him. Desperate for relief from crippling pain, they put their faith, their spines, and their lives in his hands. But for most of them, that trust was devastatingly misplaced. Over 2 years, 33 of his patients would enter his operating room for what they thought were routine procedures and leave maimed, paralyzed, or dead. This is the story of how Dr. Christopher Duntsch became known as Dr. Death, and how the very system designed to protect us allowed a butcher to hide in plain sight. In late 2010, the Dallas medical world was buzzing about a new recruit, Dr. Christopher Duntsch. On paper, he was a superstar. He wasn't just a medical doctor, he was a PhD, a rare combination that suggested an incredible intellect. His 12-page resume was dazzling, detailing a prestigious neurosurgery residency and spine fellowship at the University of Tennessee Health Science Center. He was involved in pioneering stem cell research and even had his name on patents. For a reputable hospital like Baylor Regional Medical Center at Plano, he was a golden ticket. Baylor representatives later said they were told Duntsch was one of the smartest surgeons their program had ever trained. To his patients, Duntsch was a savior. He was supremely confident and had a charisma that could draw anyone in. In a world of chronic pain, his absolute certainty felt like a lifeline. He didn't just suggest he could help, he guaranteed it, often telling people he was the best surgeon in Dallas. They saw a doctor who seemed to be a master of his craft and who appeared to genuinely care. He quickly built a practice, hired staff, and began scheduling surgeries, projecting an image of massive success. But behind the degrees and the magnetic personality, a much darker reality was taking shape. Friends from his residency in Memphis, Tennessee, would later tell unsettling stories. They remembered him allegedly showing up for hospital rounds after nights of using cocaine and LSD. At one point, he was even sent to a program for impaired physicians, but was mysteriously allowed to return. Disturbingly, it was later revealed that while a typical neurosurgery resident participates in over 1,000 surgeries, Duntsch had completed fewer than 100. This shocking lack of experience was a fatal secret, hidden behind a wall of bravado. The first person to feel the terrifying gap between Duntsch's promise and his reality was his own childhood friend, Jerry Summers. After a car accident left him with neck and back pain, Duntsch, his old friend, promised he could fix him. The surgery took place in February 2012. Summers went into the operating room trusting the man he grew up with. He woke up a quadriplegic. Duntsch had damaged a vertebral artery, causing catastrophic bleeding that choked his spinal cord. It wasn't just a mistake, it was butchery. The damage was so severe that Summers was left a prisoner in his own body. In a chilling twist, Summers initially told hospital staff that he and Duntsch had taken cocaine the night before the surgery, though he later retracted the statement. In February 2021, Jerry Summers died from an infection considered a direct complication of the paralysis inflicted on him years earlier. The miracle worker had arrived in Dallas, but he brought a plague of devastation that was just getting started. The horror of what happened to Jerry Summers should have been a full stop, a career-ending catastrophe. Instead, it was only the beginning. Jerry Summers' horrifying outcome wasn't a one-off. It was the start of a pattern that tore through the Dallas medical community. Almost as soon as he started at Baylor Plano in late 2011, Duntsch's colleagues realized the man in the operating room didn't match the man on the resume. One of the first to sound the alarm was Dr. Randall Kirby, a veteran surgeon. Kirby was immediately put off by Duntsch's constant boasting, but his concerns soon went far beyond that. When he saw Duntsch in surgery, he was stunned by his incompetence. As Dr. Kirby later put it, he could not wield a scalpel. He wasn't exaggerating. Duntsch's surgeries were chaotic. He seemed to lack a basic understanding of human anatomy. One of his first patients at Baylor, Kenneth Fennell, went in for back surgery and was left in chronic pain after Dunch operated on the wrong part of his back. Another patient, Lee Passmore, had a spinal fusion in December 2011 that was so botched, another surgeon, Dr. Robert Hoyle, had to physically grab Dunch's instruments to stop him from causing more damage. Then came Kelly Martin, a 54-year-old schoolteacher, who needed a relatively simple procedure. After the disaster with Jerry Summers, Baylor had briefly suspended Dunch. When he returned, Martin was one of his first patients. During her surgery, Dunch sliced a major blood vessel. He either didn't notice or didn't care. Kelly Martin bled to death in the recovery room. After her death, Baylor finally took action, sort of. They let him quietly resign in April 2012. Instead of reporting him to the National Practitioner Data Bank, a database designed to stop dangerous doctors, they gave him a letter stating there had been no restrictions on his practice. This act of institutional cowardice, of passing the problem along instead of protecting the public, would directly enable the horrors to come. Armed with his letter of so-called good standing, Dunch landed on his feet with shocking speed. By July 2012, he had temporary privileges at Dallas Medical Center. His second surgery there was on a woman named Floella Brown. Like Kelly Martin, she went in for a standard spinal fusion and never went home. Dunch severed her vertebral artery and then packed the area with so much of a clotting agent that it cut off blood flow to her brain, causing a massive stroke. Floella Brown was left brain dead. As Brown lay dying in the ICU, Dunch was scheduled to operate on another patient the next day, 71-year-old Mary Efford. Hospital officials, panicked by the disaster with Floella Brown, begged Dunch to cancel the elective surgery. He refused. He went ahead with Efford's surgery, where he misplaced hardware, severed a nerve root, and left her in so much pain she would later compare it to childbirth. She woke up unable to control her legs, her life destroyed, and confined to a wheelchair. This is when a second hero entered the story, Dr. Robert Henderson. A respected surgeon, Henderson was called in to try and fix the wreckage of Mary Efford's spine. When he opened her up, he was stunned. The surgical hardware was floating in her muscle tissue. Her spine was riddled with misplaced screw holes, and a major nerve had been completely amputated. Henderson simply couldn't believe a trained surgeon could do this. He later said he thought Dunch must be an imposter because the incompetence was so profound. This was the final straw for Dallas Medical Center. After less than a week, they revoked his privileges. But just like Baylor, they failed to report him to the National Practitioner Data Bank. They had stopped the bleeding in their own hospital, but they had once again let a predator back into the wild. Dr. Henderson, however, wasn't going to let it go. Along with Dr. Kirby, he began a relentless campaign, sending a detailed complaint to the Texas Medical Board, the state agency in charge of disciplining doctors. The battle to stop Christopher Dunch had finally begun, but the system itself was dangerously slow. With 2 hospitals behind him and a trail of mangled patients, Christopher Dunch should have been finished. But the system designed to protect patients was failing. The resignation letters allowed him to hop from one hospital to the next, with each new institution seemingly unaware of the destruction he'd just caused. And so, the carnage continued. His victims were everyday people. People like Barry Morgulhoff, who went to Dunch for a spinal fusion. Dr. Randall Kirby, who had already seen Dunch's ineptitude, was assigned to assist. He watched in horror as Dunch struggled with the most basic steps, eventually leaving Morgulhoff with bone fragments lodged in his spinal canal. After the surgery, Morgulhoff was in agony, but Dunch dismissed him as a drug seeker. Jacqueline Troy sought help for a spinal issue and woke up in a living nightmare. Dunch had somehow punctured her trachea and vocal cords, leaving her unable to speak above a painful, hoarse whisper. Philip Mayfield, a truck driver, went in for a simple procedure in April 2013 and woke up paralyzed. Dunch had drilled directly into his spinal cord. Mayfield eventually learned to walk with a cane, but remained partially paralyzed and in constant pain. He tragically died in 2021 from complications of COVID-19, which his wife said he was vulnerable to because of the injuries Dunch inflicted. The list goes on. In just 2 years, Dunch operated on around 38 people. Of those, 33 were seriously injured or killed. These weren't just surgical complications. They were what one surgeon described as never events. Catastrophes that should never happen even once in a surgeon's entire career. How was this possible? It was a catastrophic systemic failure. Hospitals, terrified of lawsuits, repeatedly chose to let Dunch resign rather than firing him and reporting him to the National Practitioner Data Bank. Meanwhile, the Texas Medical Board moved at a glacial pace. Doctors Henderson and Kirby sent their first formal complaint in July 2012, but the board was used to investigating billing fraud, not a surgeon who seemed to be what Dr. Kirby called a crazed maniac. While the board collected paperwork, Dunch kept operating. His final surgery was on Jeff Glidewell in June 2013. During a routine neck procedure, Dunch mistook a piece of muscle for a tumor, sliced a vocal cord, tore a hole in Glidewell's esophagus, cut an artery, and then left a surgical sponge in his throat. Dr. Kirby, who was called in to clean up the mess, was appalled, later testifying, "It looked like Christopher Dunch tried to decapitate Mr. Glidewell." That was the last straw. Kirby sent another furious complaint to the board, calling Dunch a sociopath and a clear and present danger. Finally, on June 26, 2013, the Texas Medical Board suspended Christopher Dunch's medical license. It was permanently revoked that December. The Butcher of Dallas had been stopped, but the fight for justice was far from over. The systemic failure that allowed Christopher Dunch to operate for so long is a terrifying reminder of just how vulnerable we all can be. If you believe these kinds of deep dives are important, please consider subscribing to the channel. Your support helps us continue to bring these critical stories to light. Now back to the story. With Dunch's medical license gone, the immediate danger was over. But for his dozens of victims, it wasn't enough. A revoked license couldn't undo the paralysis or bring back the dead. Doctors Henderson and Kirby feared Dunch might just move to another state and start over. What he had done felt different from malpractice. It felt criminal. They took their mountain of evidence to the Dallas County District Attorney's Office, kicking off an unprecedented idea: to prosecute a doctor, not for a civil mistake, but for a violent crime. It was a huge legal challenge. For a criminal conviction, prosecutors had to prove that Dunch acted with criminal intent, that he knowingly caused injury. The case stalled until a tenacious prosecutor named Michelle Shugart took it on. She and her team sifted through the wreckage of Dunch's 2-year reign. What they uncovered was a clear pattern of shocking disregard for patient safety in nearly every single case. They needed a smoking gun to prove his mindset, and they found one in a chilling 2011 email Dunch wrote to his assistant. In it, he said, "I am ready to leave the love and kindness and goodness and patience and become a cold-blooded killer." This became the cornerstone of their argument. In July 2015, just before the statute of limitations was set to expire, a grand jury indicted Christopher Dunch on 5 counts of aggravated assault, causing serious bodily injury, and 1 count of injury to an elderly person. Prosecutors decided to focus the trial on that last charge, the maiming of 71-year-old Mary Eford. It was a strategic choice, as a conviction carried a sentence of anywhere from 5 years to life in prison. The trial began in February 2017. Dunch's defense argued he was just a poorly trained surgeon and that the hospitals shared the blame. But Michelle Shugart and her team dismantled that defense by showing the jury one devastating story after another. They heard from his victims, like Jacqueline Troy, who could barely speak. They heard Dr. Kirby describe how Jeff Glidewell was nearly decapitated. Dr. Henderson explained the pockmarked spine and amputated nerve root he found in Mary Eford. The prosecution's argument was simple and powerful. They argued that even if the first botched surgery was a mistake, a competent surgeon would have stopped. Dunch did the opposite. After each disaster, he just moved on to the next victim. His refusal to stop was proof that what he did to Mary Eford wasn't an accident. It was the predictable result of his conscious decision to keep operating, knowing the harm he was likely to cause. As Shugart told the jury, he had sentenced his patients to a life of pain or death and deserved the same lifelong sentence they received. After a 13-day trial, the jury deliberated for just 4 hours. The verdict came back: guilty. Christopher Dunch was now a convicted felon. For the punishment phase of the trial, prosecutors brought 10 more of Dunch's maimed patients to the stand. The jury heard story after story of lives destroyed by chronic pain and paralysis. The weight of the evidence was crushing. After deliberating for only an hour, the jury made its decision. On February 20th, 2017, Christopher Dunch was sentenced to life in prison. The courtroom erupted in relief. Mary Efford, speaking to reporters from her wheelchair, said, "Finally, after 4.5 years, justice has been done." The conviction was historic. It's believed to be the first time in U.S. history a surgeon was convicted of a violent crime and sentenced to life for actions performed during surgery. It sent a powerful message. A scalpel, in the wrong hands, can absolutely be considered a deadly weapon. Dunch appealed his conviction, but it was upheld. Today, he is an inmate at the O.B. Ellis unit near Huntsville, Texas. He won't be eligible for parole until July 2045, when he will be 74 years old. For his victims, there is no return to normal. They live with walkers, wheelchairs, and the trauma of being betrayed by someone they trusted to heal them. For them, the life sentence Dunch received is a mirror of the one he gave each of them. The case of Dr. Death is a chilling story about one malignant man, but it's also a profound indictment of the system that let him run wild. From the residency program that graduated him despite knowing about his lack of experience, to the hospitals that passed him along to avoid lawsuits, to the state medical board that moved too slowly, the entire system failed. If any one of those safeguards had worked, dozens of lives would not have been ruined. But the legacy of Christopher Dunch is also a story of heroism. It's the story of Dr. Robert Henderson and Dr. Randall Kirby, who risked their careers to wage a war against a broken system. It's the story of prosecutor Michelle Shugart and her team, who forged a new legal path to make sure Dunch's actions were called what they were, not malpractice, but a crime. The story of Christopher Dunch is a dark chapter in medical history. It shows that credentials on a wall are not always a guarantee of competence or compassion. He was a butcher hiding in plain sight, protected by a system that valued reputation over responsibility. While his conviction brought a measure of justice, it can't undo the suffering he caused. His case remains a harrowing cautionary tale and a tribute to the victims and the heroes who fought to ensure that Dr. Death would never harm anyone again. Thank you for watching. If you found this investigation compelling, please subscribe for more deep dives into the stories that shape our world. We'll see you in the next one.